Hi, my name is Amy Whitmore. My D number is 411-05325, Chamberlain University, New Orleans campus. This is NR224, medication administration, SubQ and oral. Alright, so first thing I need to do is get my medicines together. I am going to look at my MAR, my medication administration record. So what I'm doing is I'm determining which medicines to give, and I'm also looking on this chart to see if there are any known allergies or other contraindications that would mean that I should not give these meds at this time. Do not see that. So now I'm going to have a quick look at my medicines, and I'm going to make sure that this is the right medicine to give right now. This is the right dose. This is the right route. This is going to be the right time, and I am also going to check the expiration date. And I'm going to do the same for the oral medication as well. Now, I need to perform any calculations that I need in order to administer the correct dose. Once I do that, I'm going to ask a second nurse to come and verify my calculations, and then I am going to draw up my SubQ medicine, and I am also going to get the correct medicine for oral to bring into the room. So the first thing I'm going to do is draw up, per my calculations, the correct amount. Once I draw up the medicine, I'm going to discard the rest of the medication, and I'm using the one swoop method to pick up, I guess it would work if it went the right way, to pick up the needles. There we go. So I did the one swoop method to pick up the needle. I'm going to cap it back on, make sure it's good to go. So I have both of my medications now, so I'm going to gather everything together, and I'm going to head into my patient's room. So, knock, knock, knock. Hello, Miss Quinzel, how are you today? I am here to give you some medicines. Dr. Isley has ordered some medicines. So before I get started, I'm going to place my medication on a clean surface, and I am going to verify that you are who you say you are. So let's have a look at your armband. Let's see, your name is, full name, can you state your full name for me, please? Harleen Quinzel, excellent, thank you. And your date of birth? 12/26/92, excellent, I see that. And are you in any pain at this time on a scale of 1 to 10, 10 being the worst? All right, a 0 out of 10, that is excellent. And are you allergic to any medicine that you know of, or have ever had any adverse reactions to any medicines? Okay, excellent, good deal. So now what I need to do before I get started, I am with my MAR right now, my medication administration record. I have it here next to the bedside, and again, I'm going to check my medicines just to make sure that everything is still in the up and up. So again, I'm going to check the right dose, the right route, the right that this is in fact the right drug, and that I am administering it at the right time. So I have verified that one. I have also verified my SubQ medication as well. So all right, we are going to get started. Now the other question I need to ask, have you ever had any trouble, do you have any trouble swallowing, or have you ever had any trouble swallowing any medications before, Ms. Quinzel? No? Excellent. Okay, great. So which would you like first, the needle or the oral medicine? Yeah, most people prefer the needle first. I do understand. Excellent. Okay, good deal. So I've got I did some hand hygiene. I have put my gloves on. Now what I'm going to do is I am just going to raise up your bed to hip level for me. I'm just going to lower this one side rail so I have access easier to you. Let's lift up your clothes to where where I can expose your belly. Excuse me, just one second. My one of my little nursing assistants is here, so I apologize. So we have lifted up the sheets and the clothing to expose the belly, the abdomen area. So what I am checking now is to see that there are any lesions, trauma, inflammation. Do I see any bony prominences in the area? I do not see any of that, so I'm going to go about 1 inch from the umbilicus. I am going to cleanse the area with antimicrobial wipes and discard the wipes, and then I am going to gently pinch the area with my non-dominant hand. But first I'm going to uncap my needle. Now I'm going to pinch the area, the SubQ area. I'm grabbing some SubQ tissue with my non-dominant hand, and using a 45 to 90 degree angle, I am going to insert my needle. I'm going to insert my needle. I am going to release the skin, and I am going to inject my medicine into the site. Then I'm going to remove the needle. I am going to put the safety device on. Unfortunately, this one doesn't have a safety device, so I'm going to use the one swoop method again to make sure that it is secure. And I'm going to put that into a Sharps box. Oh, my service dog is awake now too. Awesome. Now, I am going to discard all of my supplies. I'm going to check to see if there's any bleeding or adverse reactions in the area, and I don't see anything, so I am going to put a Band-Aid over the area where I just injected and discard my gloves in the appropriate receptacle. And I'm going to pause for a quick break because my nursing assistant needs something. Okay, my nursing assistant has been taken care of. So now, Ms. Quinzel, we're going to give you that oral medication. So again, I'm going to do one more check. I'm going to make sure this is the right dose, right route, right time, right drug. And we are going to put the prescribed amount into the cup, and only the prescribed amount into the cup. And I'm going to give Ms. Quinzel a cup of water with a straw. And Ms. Quinzel, I have, before I do that, let's elevate your bed up to about 30 degrees or higher, semi-Fowler's position, to make it easier to swallow. And let's give you the water right here. I'm going to give you your cup. The patient has taken her medication and swallowed. She's taken a sip of water, and I am not noting any choking or any trouble as far as that goes. So I'm going to discard my cup and any of my other supplies at this point in the appropriate receptacles. Let's lower the bed down, make sure it's locked, lift up any of the side rails that I might have put down. Here, Ms. Quinzel, I'm going to give you your call light back. If you need anything or you experience any trouble, please let us know, and we will, and I'll come back in here and have a quick look at you. I'm going to perform hand hygiene one more time, and I am going to leave and make sure that I have documented everything that I need to. The patient did not refuse or withhold any medicines. We were able to give both the SubQ injection and the oral medication at the right time, the right dose, the right route, and it was the correct drug, and we did not have any adverse outcomes for either medication. And I am going to sign off on this, and we are good to go. Thank you.